Between classes, work, family, everything in between, how do you keep going when your schedule feels like it's breaking you? Because for a lot of students, this isn't just busy, it becomes overwhelming. If you are trying to hold everything together right now, this episode is for you. Welcome to Voices of Vital Care. I'm Nohelani Graf. We want to welcome you to Voices of Vital Care. Helping us with this important conversation today, we have brought in two experts. We have Michelle Carlin, who is a board-certified psychiatric and mental health nurse practitioner and also founder of Monarch Health and Wellness, with over 15 years of experience helping patients navigate stress, anxiety, and overall mental wellness. And then we also have Brenna Drago, and she is a student services leader at Pima Medical Institute, known for guiding, supporting, and advocating for students through their journey and helping them overcome challenges so that they can stay on track toward their goals. Ladies, I want to thank you both for being here.
Thank you for having me.
This is a big topic, but it's a really important one. It's so relatable, I think, for so many people in so many facets of their life. We will focus a little bit more, though, on the allied health field, on the medical field, and combining student life with that as well. So first, I would like to start with you, Michelle, and from your perspective, and Brenna, you can certainly jump in afterwards as well. But talk to me about when interacting with students and their mental health. What are you seeing?
I've seen a lot of change since COVID has happened. So the stressors have definitely changed. Students are not doing as well in person, being back in person and socializing, and that's impacting them socializing and communicating with their professors as well. Many are also working at the same time, which is an additional stressor, and the finances cause additional stress with them being able to have the time to focus on their studies. And the students trying to figure out how to navigate all that and how to manage and juggle all of that is difficult. A lot of them also have families or children of their own as well. And so there's a lot of burnout happening and a lot of anxiety that can lead to depression as well.
There's a lot that we're going to kind of pick apart there. Brenna, if you had to in a couple of sentences, what do you see?
I have to echo what you said. It's just for us competing demands on our students. So you have a full-time job, but you want to change your life and you want to get into the medical field. And there's a lot that goes from the first start to the starting to the end that can come in and get in the way of that.
A lot of self-imposed pressure.
Absolutely.
I would imagine when you're talking about it that way. So let's start kind of from the top down of what you had said, Michelle, with one, that's social anxiety, because we're talking about a generation that's just coming off of, certainly if they're doing a path where they're straight out of high school, or even if they took a year or two off, they were the ones that were learning remotely for those final years. And so that's factoring into this of how to interact again.
Absolutely.
Well, what I was going to say on that is a lot of times the lack of social interaction leads to them not asking for help when they need it. And so they may need it, but they don't know how to ask. They don't know who to go to. We see a lot of that.
And same for my practice as well. So I'd say a lot of my older clients call to make appointments. The younger clients usually go through our website and do an inquiry through that. And then we end up having to call them back or respond. They like to do through text message instead because a lot of them are having anxiety about even making phone calls.
Yeah, that total interaction, just human to human contact.
Yes.
Do you find that at least having a resource where you can still do telehealth, does that ease some of it?
Yes, I think I require them to be on camera. Most of my clients use insurance as well, so it is a requirement. But I would say being able to see them even for their initial evaluations and the first few appointments helps them to be more comfortable then with starting to come in person and accept resources and maybe referrals to individual therapists and things to work on those as well.
And then Brenna, you talked about another layer that you were adding in also is just that adding in all the things. Maybe they're still working while also carrying their classwork, plus the demands of that classwork.
Exactly. And really, where my student services team comes in to try to assist with those different facets of going to school and the demands is really just to unpack what they're going through. That's really important to us, is to truly understand and individualize our coaching and our mentoring.
So when we are walking that line, then, as someone who's listening and they're thinking about, where their stress level is at, what would you say, Michelle, are some of the indicators of my stress has hit that point where it is no longer manageable? Now I need to reach out.
I would say a lot of people have thoughts where they can't stop thinking about their stressors. It's intruding on every aspect of their life and they can't move past it. Their sleep is decreased. I know that there was a study recently since 2007 to now that there's a 23% decrease in amount of how many hours teenagers are sleeping. And so the average is 5 hours per night, which, as we know, is not good.
Do you think part of that is doom scrolling?
Oh,
and
yeah.
They're just on
Absolutely.
a device, so they're not sleeping because of
Yes.
that as well? Okay.
Social isolation is a big key as well, and increase in fatigue, feeling like you need to sleep more than usual. And I also notice people just not eating as well either.
Are you noticing, Brenna, when people come in that they're coming in, but they're past that management point?
Well, yeah, because when it comes to overwhelm, someone might not know that they're overwhelmed and they're feeling that
Yeah.
anxiety and not knowing where to turn. And so sometimes what we see when students get into that headspace is like, I'm just going to quit and I don't want to ask for help because I should be able to do this on my own. And so that is also where my team partners with our faculty members a lot of times to really try to notice those signs when they're not posting into their class, they're not coming to class, they're not participating, they don't have that confidence. And so recognizing those signs early makes such a big difference with overwhelm.
And are we seeing, you mentioned sleep as that could be like a physical attribute of the stress level. Are there any other physical implications that are happening that either of you are seeing? Ooh, you're nodding your head, Brenna.
Yeah. Sometimes we see personal appearance start to decline and personal hygiene.
Yes.
And, we will have those conversations. They're delicate.
Sure.
And we want to, really make sure that we're not, we're coming at the student, coming alongside them to let them know we're on this journey with them.
Absolutely.
But yeah.
And we see a lot of family members, parents even calling to try to get their students set up for services. Obviously,
Yeah.
we need to talk to them since they're over the age of 18 to get started with services. But even just making that first step has been very difficult. A lot of people think that they're having gastrointestinal issues, migraine headaches, neurological issues, when really when it comes down to it and they've been evaluated, it's really based on what's going on mental health wise.
Things that might lead somebody more so to check in with urgent care, maybe, that when really it's here. And so that might lead into this then, Michelle, of what is, the danger to your body and the impact of just handling that pressure over time for, prolonged amount of time.
It definitely can cause problems with your gastrointestinal system, thought blocking, a lot of neurological issues that can happen related to that. Some people feel like they're having a heart attack or and end up going to the emergency room for that when it's actually anxiety. It can impact your nutritional balance as well and cause problems with your kidney function. All types of things metabolically can happen.
Wow, that's really scary. And that
It
a
is.
lot of long-term impact.
Absolutely.
And so, Michelle, you're mentioning about, families sometimes finding their way through you. That might be how students find their way
Yes.
to you. Brenna, before that happens, and if there's intervention on campus at Pima Medical Institute, what are you guys doing there that you're able to then direct, or how do you find your students that are in need?
So we start out in orientation. When they come to orientation before they start, we let them know you have resources. We're at the ready to help you when life kind of gets in the way. You made this commitment to come to school, and boy, are we excited to have you. But just know that if and when you have a personal crisis or something that really starts to spill over, and you're not able to spend the time that you need to on school, that you have a resource, and that's the student services coordinator.
That's
And
great.
Yeah.
this is something that if you're listening to this and you're hearing some of these pieces and thinking this is exactly where I'm at, that I am struggling and I don't know where to go, I want you to keep listening because these next parts are very important. It sounds to me like a big piece of that by introducing it right off the bat for students is also helping destigmatize
Right.
asking for help, destigmatize, what it means if you are struggling with mental health. Is that accurate?
Absolutely destigmatize. And you're not alone.
Right.
You are not alone on this journey. And getting into the medical profession, it's not like going to a traditional university. You're learning a skill and you're preparing for a career. And so that's going to be something where if you come to us and we are able to help you, that's a skill that you built and you grew from.
Absolutely. And as a provider, for me, I can speak personally. I work with universities to help get accommodations approved or things that we can help the student get. So those things are available as well. So maybe that looks like more time for testing or to get assignments completed, or for a little while, a shorter or a smaller client load as far as when they're in clinicals and things like that, that we can work around so people can still be successful in their programs.
Because I would imagine also, specifically with a field that's in healthcare and the medical industry, part of you are involved in it because you're looking to help other people. And you might be
Exactly.
that person of that mindset who's like, I don't want to add to somebody else's plate. I'm
Right.
here to
Yes.
heal people, take off their plate. So then that might be a deciding factor, unfortunately, sometimes of, well, if I go ask for help, yeah, I'm going to get sent to a place to add to the bill if, their parents are helping or if they're there on scholarship or,
Right.
working the second job to keep themselves
Sure.
there, that they're afraid to ask of, well, they're just going to tell me that I need to do something else that's going to cost more. So that's a huge barrier to help remove.
Absolutely.
Wow.
Yeah.
Yeah.
And we have a student assistance program that we work with for that reason, where they can get tele appointments for mental health. And they have a whole suite of services with this vendor that we partner with. But you're right, we want to make it as easy and accessible as we can, because if we add another barrier, that just becomes even more overwhelming.
Right.
Sure.
So the accessibility is really important.
And I know that, we can have these conversations in broad terms
Right.
and we can hear about the resources that are available and come take advantage of them. Don't be afraid. But sometimes you really do need to know that someone has taken that step, that, has gone through it, that it has worked. Do either of you have a situation that you'd be willing to share of maybe a student that did, find their way to you and what that looked like? What was their overwhelm and how did they get through without, sure, we, want to be
Very
mindful
general
of,
terms.
yeah.
Yes. So we had a student who he was experiencing voices in his head and suicidal ideations along with that. And we connected him with our vendor partner for a mental health session, and they determined that he needed to actually see a psychiatrist because he possibly had dissociative personality disorder. They weren't diagnosing him by any means, but he just graduated. He went and
Amazing.
sought,
Wow.
medication. He wasn't getting support from his parents, and so he was able to move out. And like I said, he recently graduated and has a job as a medical
Managing.
assistant.
Wow. What does that say to you, Michelle, when you hear that?
Oh, I love that you have that much resources available.
Yeah.
And it sounds like doing that in orientation is amazing. So people know that it's there and they don't have to search for it, for
Right.
sure. And, I've had a lot of nursing students that come to me and they feel like I'm going to have to drop out. My clinicals are too overwhelming. I don't know how this medication's going to cause me to feel and be able to function while I'm at school. So I've had a number of students where they're just feeling overwhelmed and they get an imposter syndrome where
Yeah.
they feel like they shouldn't be doing this or they're not skilled enough to be doing it.
Sure.
So we work through that with their professors, get them accommodations that are needed, set them up with their individual therapists as well to talk to,
That's great.
work on medication management for medications that aren't going to impact them while they're working, or let them know what possible symptoms their clinical instructor could look for them as well. And they've all graduated. They're all working as nurses right now. So
Wow.
it's amazing.
That's fantastic.
And it
Taking
just-
that holistic approach.
It
Yes.
sounds like a real step forward. So many professions have evolved in kind of the way they may have been before. And, without this piece, a lot of times, certainly within that first responder field, where there are just different expectations or thinkings of how to handle mental health, and that has changed and evolved. And so in this also, maybe for, maybe you have someone, you come from a medical background, a family of nurses and different practitioners, and they had a different experience where mental health was shelved or it was not something that was
Absolutely.
addressed. But to let people know now that, it's different. There are ways through that can get you through that. It's not normal
Absolutely.
to have to shoulder all of it.
And while
Exactly.
COVID was a terrible time, it also helped get telehealth in the forefront.
Yep.
So I have many students that will see me on a lunch break in between classes via telehealth or at the hospital, and they go to the doctor's lounge or the nurse practitioner lounge, nurses lounge, to do their appointment in an area where it's still secure, and they can do that and still be on site for their clinicals and not missing any time at clinical.
Do you
That's
find, Brenna,
incredible.
that you have more proactive students too? Because this generation does also think about mental health a little more openly
Yes.
Sure.
than those past. So, while the pandemic may have impacted them in one way with socialization skills, but also that talk around mental health, I feel in my experience that I meet many in this generation that now do wholly believe in it if they
Yes.
believe that they can have access. Do you see some coming maybe who fortunately have not hit that breaking point just yet and realize, I want to check in and see?
Well, I have to agree with you. The stigma seems to be relatively removed from the mental health, seeking the help, but also accepting the fact that you might have something going on and that you need help. And so we've seen in our student population overall, they're very open to that.
Good.
During orientation, we have them download the app for that student assistance program, and we say, you never know when you're going to need it,
Absolutely.
Yeah. So let's zoom out for a moment and kind of put some practical talk to work here.
Sure.
Let's talk about balance, because I feel like that has become a buzzword often where, in all facets, whether, whatever the industry that you're working in, or you're just talking about, your home life, we talk about balance. And I think people have different ideas of what that means. And certainly when you are a student and you're in a demanding program, what balance really looks like, what it should look like, what is acceptable. So from both of your perspectives, Brenna, from your point of view, for a student in that season of life, what should balance mean?
Well, balance should mean that you can't be a superhero.
Right.
You have to accept your limitations. And one of the things that we can help students with is kind of unpacking their big rocks and figuring out, how can I get to the big rocks that I need to get to, but also everything else. And really, that can look like a time budgeting tool.
Right.
Where we break down, what does your week look like? Could you, borrow from here to put here for homework? And really just learning how to self-advocate, I think, is big, because oftentimes our students are first generation, and there isn't a deep understanding with their family or their social or their support what time commitment truly looks like for them. So that's
Yeah. Michelle, what can you add for balance from a clinical perspective?
So self-care is key, is what I tell all of my clients. That can look like different things for different people, of course. So we kind of go through what your interests are, what makes you feel happy and can get your mind off the work, even if it's for a little bit. I like to go over a day's schedule with people throughout the week to find out when they say, I'm overwhelmed, I just don't have time, to see if there's any little piece we can take out. You mentioned doom scrolling earlier.
Yeah.
And you get stuck in that spiral, and that can take up a couple hours at the end of the night when you could be focusing on something else self-care wise that would help improve your balance.
And I like that you said with self-care that you talk to them about what their interests are, because I think also, as can happen with a doom scroll, is you see someone, maybe an influencer, who makes self-care look a certain way.
Right.
And so then the automatic thought is, well, self-care means I need a full spa day afternoon, or,
Exactly.
that's going to cost more money,
Yes.
or
Right.
it just means different
little
things, or it's my
things.
date night, or it's my this or
Yes.
that. That is not what self-care has to mean,
Correct.
especially in small increments.
Absolutely. And self-care can even be small things where you're doing breathing techniques even while you're at school or at your clinical that take a minute or a couple minutes, just things to break up your day and stop with that, the spiraling going on in your brain.
Is there, in your experience so far with students, that anything that you see they are pushing through, really trying to, just this is a small thing and not recognizing that that's actually something that's hurting them, that they shouldn't just be pushing through?
Sleep, I would say. They say, I'm just going to stay up tonight and push through that assignment. And, I just need to get it in. But a lot of times if you're up, 14, 16 hours, your brain is not functioning well enough to really finish that assignment to do it adequately as well. When resting even for 5 to 6 hours, you can wake up a little more refreshed to get those things done, or fitting in some exercise somewhere as well. And, that helps with endorphins and things and can get you reset so you can sit back down and do your work.
Where does also, Brenna, with the overwhelm, where does guilt factor in that you see?
Guilt that they're asking for help
Mm-hmm.
a lot of times. Whether they're in tears or just extremely distraught, saying, um, I, I feel like I'm a failure
Mm-hmm.
because I'm having to ask for help. But what we say back to a student that says that is, you're going into a helping profession. And the best part about getting help is being able to turn it around and give it,
Absolutely.
and pay it forward. So I would say that's the biggest thing, is just accepting when you need the help.
And with guilt, I imagine also, certainly for those students who, this might be a second life career for them. They might
Right.
have families at
Right.
home that,
Yes.
because this isn't necessarily an all day,
Sure.
program. It's blocked in certain areas. They might be holding a different job, a second job as well.
Yep.
What do you say to someone who's carrying that load of guilt, Michelle, and how to navigate that?
A lot of them come and say they feel inadequate, right? So we just have to reframe that and figure out to find the strength in what they see as a weakness, for sure. Again, going back to the schedule and figuring out where we might be able to maneuver and move things around a little bit. Or in my case, also starting a medication that can help relieve some of that guilt and distress that they're feeling.
And carrying the guilt is one thing, because you're thinking you have to carry
Sure.
it all. And so you're trying to push through. On the other side is the thoughts of, I just can't anymore. I want to quit. I can't do it. Is that a moment, and I'll start with you again, Michelle, on this one. Is that a moment where you should be listening and say, yep, it's time to be done? Or does it just mean that you just need more tools in your toolbox to navigate, or maybe a little of both?
Maybe a little bit of both. I'd say definitely more tools in your toolbox. If you're feeling like you're over your limit, maybe with the job, or you're taking more hours than you think you can manage, figuring out if there's a way to lessen the burden on either side, or other resources in the community if you're worried about finances that you could look at to help ease that burden as well.
Brenna, how are you seeing students? What are you saying to them of figuring out tough week
Yeah.
or time to step back?
It's best to ask them, let's revisit why you started.
Right.
When we have students fill out forms in the beginning of their program so that we can refer back and say, okay, you indicated that you're doing this for your child.
Yeah.
And you don't have to quit. You can have a bad day, a bad week, like you said, but let's look at what your ultimate stressors are, and then let's find a way to, because school is a sacrifice. You know, we've all been through that, but it's a short-term sacrifice that yields long-term benefits. And so
Absolutely.
it's like just trying to emphasize the fact that we don't want you to quit, and you don't have to give in to those self-doubt,
Right.
self-doubting feelings.
And also being able to recognize within yourself and learning how to recognize the difference between a bad day, a bad week, and an overall, this is just not for me, is also going to be critical
Yes.
for these students moving ahead in their careers, because they
Right.
are all entering a career where there will be bad days. You know, nobody wants to think about that,
Sure.
but that is the truth of the matter. There will be bad days, there will be bad weeks, and you will have to navigate that as you move forward.
Absolutely.
The
and do- yeah.
resiliency.
Absolutely. So, with more practical tools to add, also, Michelle, if someone is feeling overwhelmed, is there there's no quick fixes, but maybe a quick reset, a 60-second
Absolutely.
tool that you can
Yes.
readjust?
There's a couple. I mean, depending on how you maneuver, square breathing is a good one. That is something that you can do 3 to 6 times within a few minutes, where, I mean, we can do it together, but
Yeah, what is square breathe? I've not heard
so
that term.
you look in your brain or find something to trace a square. You
Okay.
breathe in for 4 seconds,
Mhm.
hold for 4 seconds, let it out for 4 seconds, and then hold that shallow area and then restart that. So it resets the circuitry in your brain to stop that negative feedback loop that the anxiety is causing.
Okay.
So they recommend to do that 3 to 6 times, which, I mean, we could all do sitting here. which
Right,
is
and just
easy.
in a row,
Yes.
three to
Yeah.
6 boxes, if you
Yes,
will. Check your 3 to
absolutely.
6 boxes
Yeah.
Absolutely.
of taking your breath.
Another one is a grounding technique with your senses. So if you're sitting here, it's 5, 4, 3, 2, 1. Easy to remember. You probably know that one too. Find 5 things in the room that you see, 4 things that you feel around you, 3 things that you can smell, 2 things that you taste, and you just work through those processes and do those steps, and that just kind of gives your body a reset.
See,
Calming.
feel, smell, taste.
Yep.
Yeah.
As you count down.
Here.
Here.
Yep. Hear what can you hear
Just the
around
focus
you?
on
Yep.
that, of
Be in the
pulling
moment.
you out of
Mhm.
Yeah.
whatever you're stuck, your spiral.
Absolutely.
Exactly.
That's fantastic.
Yes.
That's a really practical for anybody, in your moment. Because I think
Absolutely.
we hear almost cliche, like, take a breath,
Yes.
Yeah.
right? Relax,
Yes.
right? Which nothing makes you less relaxed than being told to relax.
Exactly.
Right?
Exactly.
So something actually manageable.
Because a lot of people rely on their smartwatches now, and they're like, okay, it's telling me to breathe, or like, it's telling me I'm sleeping whatever per night. It's like, that's actually causing you more anxiety to look at it.
Right, you get a little
So-
bullied when it's that 60 seconds
Yes.
rather of mindfulness, and
Yeah.
okay, let me do it, but are you really
Doing it. Yes.
doing your reset?
Mhm.
Are you seeing with your long-term patients, Michelle, that do they continue to put those things into practice? Do you hear from them? Do they make an impact long-term? That can certainly help
Yes.
in the moment, help you reset, but is there the longer-term benefit that you see?
Absolutely. And it's beneficial to start with small short-term goals so that they can get quicker success and then add on to those. So there's the buy-in to continue treatment, and they're seeing results, so we can just build upon those skills, visit by visit.
And Brenna, you talked a little bit about seeing, you had the one student that you mentioned that he went through his troubles, he graduated.
Yes.
Are you also hearing feedback from students who just overall of, at the end, this really got me through. Wow,
Yes.
this made an impact. Just knowing that these resources were available, being able to put them into practice.
Yes. So we have graduation ceremonies at all of our campuses, and that's where you hear that the most.
Yeah.
It's such a joyous event, and we get all sorts of thank yous. But at the end of the day, it was you. You did this. We may have helped you along the way, but be proud of yourself. So, yeah.
That's beautiful. Okay, so I want to do a little bit of a lightning round. We'll just do, kind of 3 little questions, and you just say kind of the first thing that comes to you. They're not hard. We're not getting a test after this, right? Let's get ready to make your box.
Yes,
Take your deep
exactly.
breath. Count your square. I don't want you to get stressed about it, but just go with your gut here. So, Michelle, I'll start with you. One thing you think every student should start doing today?
Sleeping. Yes, sleeping.
There you go. That's easy. Brenna, one thing students should start doing today to set them up for better mental health?
Just forgive yourself.
Mm-hmm.
Don't be so hard on yourself.
Mm-hmm.
Yeah.
Be your best friend.
Mm-hmm.
Okay. Next one, Brenna, one thing they should stop doing immediately.
Being so hard on themselves. Again, to relate to what I just said.
It all connects.
If you get a bad grade, the best thing you can do is rebound the next time, learn from that, and put that into practice. So don't get discouraged.
Right.
Michelle, what's your thing? Stop immediately.
Blaming yourself and not being scared to reach out for treatment.
Very good. Okay. Last one. What is the number one thing that you want to say to someone who might be struggling right now?
There are so many people out there that are willing to help you, more resources than you know. A lot of times people feel like their family will be disappointed if they seek treatment, but they're going to see such a positive change in you afterwards that, maybe at first they don't even realize you're in treatment. And then later you can feel like you can disclose that information to them, for sure.
Right. Maybe they say it to you. They've seen the light return that you didn't even realize left.
Absolutely.
Absolutely. Brenna, what is your one thing to say to someone who's struggling right now?
I would say this is a moment that's going to make up many moments in your life. But whenever we're uncomfortable, that means we're growing. And you're going through a growing phase that you had the courage to start. And let's see you finish.
Yes.
Let's get you through the moment, because it's just that moment.
Absolutely.
And I know this is just the tip of the iceberg for this topic and a conversation of this weight and measure, but I appreciate both of you and your insight.
Thank you.
And beginning that conversation, I learned things. I think, our viewers are walking away and listeners are walking away with something practical that they can use. And, even those who might be a family member with them, who might be listening now and on their own, career path and life path, that they're definitely actionable steps here that you both have brought to the table that I think can make a real difference.
Thanks.
Thank you. Thank you so much for having me.
Yeah, both so wonderfully insightful. And if you are in the middle of it right now, if you are feeling overwhelmed, you are feeling stretched thin, just know that you are not alone in that. And more importantly, you're not meant to carry it alone. This is what surviving the schedule really looks like. And on the other side is something that is so worth it. If this conversation resonated with you, we ask you to subscribe to Voices of Vital Care, be part of a community that we are building for people who are doing the hard work every day. I'm Nohelani Graf. I want to thank once again Michelle and Brenna for lending their insight and their expertise on behalf of all of us here at Voices of Vital Care. I thank you for joining us, and we will see you next time.